Health experts agree we're in a race between getting everyone vaccinated and the spread of the coronavirus variants. Right now, the more contagious UK variant is becoming the dominant strain in some parts of the U.S. Madeline O'Neill takes us to labs in the state where these variant strains are being closely monitored.
The Wisconsin Department of Health Services says it's expanding efforts along with lab partners for this genome sequencing that can help identify variants of concern that can be more contagious and more dangerous. Labs explain to me how that's done. COVID-19 has rewritten our lives' narratives.
Very busy year.
If you read the fine print, the coronavirus itself tells a story of its own.
The process is kind of like reading a book that has 30,000 letters from each sample.
A book of A, T, C's, and G's, and putting that all together as a string. And then that has to be analyzed and compared against libraries, databases, to determine if this is a variant of concern.
That's what labs, including the State Lab of Hygiene and Dave O'Connor's lab at UW-Madison, have been doing since the first chapter of the pandemic, when COVID-19 testing began more than a year ago. Genome testing is done by extracting nucleic acid from coronavirus samples. Think of that as containing the virus's genetic script to detect specific changes in the genetic sequence.
And it turns from an A to a T. That might be something that you'd look at and you'd say, aha.
That can tell you a coronavirus's origin. And if the specific mutations mean the sample is a variant of concern, such as the B117 variant originating from the UK.
The one that's more contagious is definitely on the rise here in Wisconsin.
About 5% of Dane County positive coronavirus samples have been genome tested since the pandemic's start. This March, labs sequenced nearly 6% of samples in Wisconsin.
We don't need to identify every single variant, every single strain to the genomic level here in the States to get a picture of what's circulating.
We're probably north of 10% of all the cases statewide are now this B117, and soon it's going to be the most common thing that we see.
So as we turn a page with vaccinations, it's important to remember the story's not over yet.
We've got a lot of work to do to get the number of cases down to such a low level that these variants are not going to be a concern.
Because of the variants, we really do need to keep up with masking, distancing, staying smart to stop the spread. That includes getting a vaccine, which does still seem to be fairly effective against the UK strain, but perhaps not as much against other variants.